first, let me clarify how mandates work in the US. So mandates, vaccines are mandatory at school entry in the US. These are state level laws, so there's some diversity in these laws, but overall, with the exception of 2 states that only allow medical exemptions, all states allow for exemptions to these mandates. And so the way these laws work are not they're not draconian, if you will. So nobody carries someone to a vaccination clinic, etc. They work by changing the balance of convenience in favor of vaccination and away from non-vaccination. And so there's a long legislative history, etc., and they have been challenged and validated by the Supreme Court and the different, the overall concept of these laws. And so what we have found, since these are state-based laws, and there are 50 states and DC in the US where these laws are implemented, we were able to look at the variability, so the different shades of these laws, and especially in terms of granting exemptions, and what is the association with actual vaccine refusal rates. And so that's, in a way, seeking an exemption is an act of a intentional act, somewhat directly measured through these data. And so what we found was that while the rates, so I don't want to exaggerate the issue, so while the rates overall are modest, so the first thing we found was they tend to cluster. And I'll come back to the consequences of clustering, local clustering, geographic clustering. But we also found that the fewer administrative requirements you have, the easier it was to get, if you will, to get an exemption, the higher the rates of refusal were. If you looked at state data, and they're going they're consistently going up. So that's one thing. The other thing we found was that states with easy requirements had higher rates, even after adjusting for a lot of differences and what we call confounders between states. And we found that there was a substantially higher risk of pertussis in states with easy requirements for getting exemptions. So that's one thing. Even more importantly, I guess, at the local level, coming back to the clustering issues, these exemptions or refusals tend to cluster geographically. And we found in multiple states in the US that the clusters of refusers tend to overlap with clusters of pertussis, and then others have shown measles. And so there is a disease level cost associated with this, with a word of caution. Because while I work on this, and we do have data from our group and several other groups that there is a cost associated with refusal and exemptions behavior in the US, that's not the only reason why we have sort of disease outbreaks. So just to keep in mind, and it's an important reason, for example, in the context of pertussis, more important perhaps for measles, but an important reason for pertussis, but not the only reason for these outbreaks. So for example, there's waning immunity and less than optimal immunity after the acellular vaccine. So we should keep that in mind. The overall lesson is beyond sort of a country that has that legislative history. So every country has its own sort of constitutional paradigm, and within that context, laws are made and challenged and mature, etc. So not all countries would have the intention to have actual laws to mandate vaccines. So that's a given. Having said that, one should, in the discussion, remember, so the laws in the US, often misinterpreted, are not draconian. There are exemptions available. It's just what you're doing is you're nudging the balance of convenience in favor of vaccination and away from non-vaccination. And there's a ton of societal interest in doing that. While preserving individual choice, I think it's very reasonable for the society to say that someone who's not going to get vaccinated has to jump through a few extra hoops, because that's in everyone else's interest, because infectious diseases by definition are infectious and your behavior impacts my child's health. And so for that reason, that lesson, that the balance of convenience should always be in favor of vaccination than non-vaccination. For example, in the healthcare provider vaccination against flu in certain circumstances, even though there aren't any national mandates in several countries, There are several other countries other than the US where there are mandates for vaccines. But even at the organizational level, if the organization is pushing for healthcare provider vaccination, it should be a lot more easier to get them vaccinated than not get them vaccinated. So that's one example. And so that's the broader lesson beyond the US. And even in the US, beyond sort of these legislative fixes.